ISO 45001-2018 Occupational Health and Safety Standard. Hi friends, welcome to yet another episode of QHSE Knowledge World. Today we discuss about the Occupational Health and Safety Standard ISO 45001-2018. My name is Ajish. Welcome to my channel QHSE Knowledge World. ISO 45001 is an ISO standard for management system Occupational Health and Safety published in March 2018. The goal of ISO 45001 is the reduction of occupational injuries, including promoting and protecting physical and mental health. The adoption of an OHS management system intended to enable an organization to provide safe and healthy workplaces, prevent work-related injury and ill, and continually improve its OHS performance. Especially geared towards senior management, ISO 45001 has the ultimate goal of helping business provide a healthy and safe working environment for their employees and everyone else who visit the workplace. The goal can be achieved by controlling factors that could potentially lead injury, illness, and in extreme situations, even death. As a result, ISO 45001 is concerned with mitigating any factors that are harmful or that pose a dangerous to workers' physical and or mental well-being. This standard allows companies to merge their management system under a single umbrella consist of ISO 9001 Quality Management, ISO 14001 Environment Management, and ISO 45001 Occupational Health and Safety Management, which is called Integrated Management System. The standard was proposed in October 2013. At least 70 countries contributed to the drafting process. The final draft was approved and the standard was published on 12th March 2018. ISO 45000 is a generic standard which is applicable for all type of industries or organizations. The standard replaces OHSAS 18001, which is now obsolete. Let's check the major differences between OHSAS 18001 and ISO 45001. OHSAS 18001 was procedure based and it was not dynamic in all clauses, deals all exclusively with the risk, doesn't include the views of interested parties. Whereas ISO 45001 is process based, dynamic in all clauses, considers both risk and opportunities, includes the views of interested parties. So, what are the benefits of ISO 45001? Every day, thousands of lives are lost due to work accidents or fatal diseases linked to work activities. The major benefits are improves hazard identification and risk assessment, reduces downtime, overall cost of incident at the workplace and the number of insurance premium claimed, enhances the involvement of leadership and participation from workers, helps in building trust, brand integrity, reduce the risk and identify opportunities, comply with legislations. Why ISO 45001? What is the aim of this standard? The purpose of an occupational health and safety management system will provide a framework for managing occupational health and safety risk and opportunities. The aim and intended outcome of the occupational health and safety management system are to prevent work-related injury and ill health to workers and to provide safe and healthy workplaces. Consequently, it is critically important for an organization to eliminate hazards and minimize occupational health and safety risk by taking effective preventive and protective measures. When these measures are applied in the organization through its occupational health and safety management system, they improve its occupational health and safety performance. An occupational health and safety management system can be more effective and efficient when taking early action to address opportunities for the improvement of occupational health and safety performance. Let's check an overview of ISO 45001-2018. The occupational health and safety management system approach applied in this document is founded on the concept of Plan, Do, Check, Act, which is called PDCA. The PDCA concept is an iterative process used by organization to achieve continual improvement. It can be applied to a management system and to each of its individual elements. Plan. Determine and assess occupational health and safety risk, occupational health and safety opportunities, and other risks and other opportunities. Establish the occupational health and safety objectives and process necessary to deliver result in accordance with the organization occupational health and safety policy. Do. Implement the process as planned. Whatever you have planned, just do it. Check. Monitor and measure activities and processes with regard to the occupational health and safety policy and occupational health and safety objectives and report the results. Act. Take action to continually improve the occupational health and safety performance to achieve the intended outcome. Let's check the structure of the standard. The standard has been divided into 10 clauses. First, scope. Second one is normative references. Third, terms and conditions. Context of the organization. Leadership and workers' participation. Planning. Support. Operation. Performance and evaluation. And improvement. The first 3 clauses are informative clauses and the remaining 7 clauses are the requirements. Let's check one by one. Scope. This specifies the requirements to implement the standard. Normative reference. Unlike from other management system standards, there is no normative references for ISO 45001. Terms and definition. This clause states the common terminologies used in the standard. I have made a detailed video on the common vocabularies and giving the link in the description for your references. Clause 4. Context of the organization. Here starts the requirement of ISO 45001. As I said earlier, clause 4 to 10 are the requirement of this standard. 4.1 of the subclause context of the organization states the organization shall determine external and internal issues that are relevant to its purpose and that affect its ability to achieve the intended outcome of occupational health and safety management. 4.2 Understanding the needs and expectations of workers and other interested parties. The organization shall determine the other interested parties in addition to workers that are relevant to the occupational health and safety management system and the relevant needs and expectations, that is requirement of workers and other interested parties. And then these needs and expectations are or could become legal requirement and other requirement. Interested parties can be management, employees, contractors, suppliers, shareholders, communities, regulators, and legislatures. 4.3 Determining the scope of occupational health and safety management system. The organization shall determine the boundaries and applicability of the occupational health and safety management system to establish its scope. The occupational health and safety management system shall include the activities, products, and services within the organization's control or influence that can impact the organization's occupational health and safety performance. The scope shall be available as a documented information. Then the last subclause of clause 4.4 Occupational health and safety management system. Clause 4.4 requires the organization to establish, implement, and maintain a management system with continual improvement. The next clause is leadership and workers' participation. Leadership and commitments. This clause states about the top management's leadership and commitment to provide a safe workplace. The top management has to demonstrate how they are taking overall responsibilities and accountability for the prevention of work-related injuries and ill health, as well as the provision of safe and health workplaces and activities. Occupational health and safety policy. The organization has to establish, implement, and maintain a health and safety policy that shall be readily available as a documented information and shall be communicated to within the organization. The policy shall be relevant and appropriate and shall be available to interested parties as appropriate. 5.3 Organizational roles, responsibilities, and authorities. Top management shall ensure that the responsibilities and authorities for relevant roles within the occupational health and safety management system are assigned and communicated to all levels within the organization and maintained as documented information. Workers at each level of organization shall assume responsibility for those aspects of the occupational health and safety management system over which they have control. Job descriptions shall be communicated to all levels of employees. 5.4 Consultation and participation of workers. This clause states that the organization shall establish, implement, and maintain a process for consultation and participation of workers at all applicable levels and functions, and where they exist, workers' representatives in the development, planning, implementation, performance evaluation, and actions for improvement of occupational health and safety management system. Clause 6 Planning. Here starts the PDCA cycle plan. This clause gives the requirements of planning the process to ensure the success of the occupational health and safety system by identifying the risk and opportunities. 6.1 Action to address the risk and opportunities. The organization in its planning process shall determine and assess the risk and opportunities that are relevant to the intended outcomes of the occupational health and safety management system associated with changes in the organization, its processes, or the occupational health and safety management system. In the case of planned changes, permanent or temporary, this assessment shall be undertaken before a change is implemented. This clause also states that the organization has to identify its hazard, assess the risk associated with that, and assess the opportunities for occupational health and safety management system. The organization has to determine the legal and other requirements and shall plan action to address the risk and opportunities as well as legal and other requirements. 6.2 Occupational health and safety objectives and planning to achieve them. The organization shall establish occupational health and safety objectives at relevant functions and levels in order to maintain and continually improve the occupational health and safety management system and occupational health and safety performance. Clause 7 Support. This is the do section of plan, do, check, act cycle. The organization shall determine and provide the resources needed for the establishment, implementation, maintenance, and continual improvement of occupational health and safety management system. The management has to ensure that all their workers are competent enough to execute their own tasks and shall retain records for the same. The organization shall retain documented information as evidence of its internal and external communications relevant to the occupational health and safety management system. All organizations should have documented information required by the standard and determined by the organization as being necessary for the effectiveness of occupational health and safety management system. While creating and updating the documented information, certain things are there to remember, such as identification and description, format and media, review and approval for the suitability and adequacy. All documented information required by the occupational health and safety management system and by this document shall be controlled. Then operation. These 7 and 8 clauses are coming under do section of plan, do, check, act cycle. Clause 8 states about the planning and control. The organization shall establish, implement and maintain a process for the elimination of hazards and reduction of occupational health and safety risks. Plan the temporary and permanent changes that impact occupational health and safety performance, procurement of products and services. The organization shall ensure that the requirement of its occupational health and safety management system are met by contractors and their workers. The organization's procurement process shall define and apply occupational health and safety criteria for the selection of contractors. The organization also ensure that outsources function and processor are also controlled. The organization shall establish, implement and maintain a process needed to prepare for and respond to potential emergency situation and shall maintain and retain documented information on the process and on the plans for responding to potential emergency situations. Clause 9. Performance evaluation. This is the check part of plan, do, check at cycle. Monitoring, measurement, analysis and performance evaluation. The organization shall evaluate the occupational health and safety performance and determine the effectiveness of the occupational health and safety management system. The organization shall ensure that monitoring and measuring equipment is calibrated or verified as applicable and is used and maintained as appropriate. The organization shall evaluate competence with the legal requirements and other requirements as well. 9.2 Internal audit. The role of internal audit is to improve independent assurance that an organization's risk management, governance and internal control processes are operating effectively. This should be a planned activity and retain documented information as evidence of the implementation of the audit program and the audit results. 9.3 Management review. A management review is a formal, structured meeting which involves top management and takes place at a regular intervals throughout the year. The purpose of the management review meeting is to review and evaluate the effectiveness of your management system, helping you to determine its continued suitability and adequacy. The organization shall retain documented information as evidence of this management review as well. The organization shall retain documented information as evidence of the result of management reviews as well. The last clause, implement. Clause 10 states that the organization should consider the result from analysis and evaluation of occupational health and safety performance, evaluation of compliance, internal audit and management review when taking action to improve. Examples of improvement include corrective action, continual improvement, breakthrough change, innovation and recognitions. 10.2 Incident, non-conformity and corrective action. 10.3 Continual improvement. The organization shall continually improve the suitability, adequacy and effectiveness of the occupational health and safety management system. Let us check some of the example of continual improvement. New technology, good practices, both internal and external to the organization, suggestions and recommendation from interested parties, new knowledge and understanding of occupational health and safety related issues, new or improved materials, changes in workers' capabilities and competence, achieving improved performance with fewer resources, that is simplification, streamlining, etc. So from clause 2 to clause 10, as I said earlier, it is called plan, do, check at. Clause